representative of the NBSO in Los Angeles, and I'm doing this together with my colleagues in Argentina, Mexico, Texas, and Brazil. It's great to see you again. I already mentioned this is the 6th edition. We're going to talk today about healthcare. And for those new to the dialogue, let me give you a little bit of an explanation what's going to happen today. It's going to be very quick. We're going to have from 6 different NBSOs, 6 different regions, markets, short pitches, just to give you a quick overview of what the healthcare sector is doing over there. Then the most important part is that we're going to have breakouts. You have chosen 2 regions in which you want to be to talk about with the experts and other entrepreneurs active or wanting to be active over there. That's the main part, and then we're going to wrap up at the end, because then the hour you will see will fly by when you're having fun. So for those that are new to the NBSO offices, let me give you a little bit of an introduction. It's a global network. We have 22 offices in 11 countries, mostly the bigger countries. And it's all coordinated by RVO in the Netherlands, which is probably known to you. It's the agency that has a lot of instruments and tools for you to help you doing international business. And we are part of the economic network, as you can see in the following slide. This is the network in the Americas. So that's the United States, Mexico, Brazil, actually the whole Latin of America. And we are part of the consulate embassy network. So these are trade offices that can help you in the region. So, and in the following slide, you will see that each office, each NBSO office in the world has 2 people working there, equally important, the chief rep and the dep rep, as we say. So they are always here available for you to help you. And these are little, let's say, power teams for you to be on the ground. You're going to meet them today in the breakouts and also during the presentations, which is going to be starting pretty soon. Let me explain you a little bit about how the breakouts will work. Oh wait, let's not start with explaining how the breakouts work. Let's first give you a short overview of all the regions. So right now I'm going to give my colleagues the word, and they will give you a very quick overview of how the healthcare sector is looking like. And if you have questions, you can ask them in the chat. You can wait for the breakout, and obviously you can also contact us afterwards. So I'm going to start with Mexico today, and Mexico will be presented by René Spaan. René, the floor is yours.
Yeah, thank you very much, Peter. Good afternoon to you all. My name is Gerais Spaan. I'm Deputy Representative of NBSO in Mexico. I'm also happy that Alex de Kerpel, my colleague from the Embassy in Mexico City, is also joining this call. I would like to give you a short overview about the health industry here in Mexico. We have more than 5,000 hospitals in the entire Mexico, which is almost 50 times bigger than the Netherlands. And it's good that we have so much hospitals because you have a lot of diseases here also here in Mexico. The top 5 you can see also on the slide. For example, the heart diseases, diabetes, cancer, liver diseases, but you, of course, you have also a lot of accidents here in Mexico. And almost 16% of the Mexican population is the diabetic, which is twice the percentage of diabetics in other countries. Next slide, please. The health system in Mexico is also pretty different than the Dutch one. Just 2 million people of the 130 million people in Mexico has a private health insurance, which is a really small percentage of the entire population. And just 40% of Mexicans, they do have a health insurance. So 60% doesn't have anything. 30% of the people here in Mexico, they have insurance with IMSS. IMSS is the national health insurance provider from Mexico. So if you are a worker, then you're officially also an IMSS registrant, which you also officially are a person that has the health insurance. And also 60% of the money spent in Mexican healthcare goes towards diabetes treatment. So diabetes is still a really huge thing here in Mexico. You can go to the next slide, please. Of course, where you have problems, you also have a lot of opportunities in Mexico. Especially also here in our state in Querétaro, which is 3 hours away from Mexico City. We see a lot of development and new hospitals. In the 3 years that we are here, 4 new hospitals has been built. So all those hospitals, they also need to have equipment. They also need to have knowledge. They also need to have help from other countries. We also have several Dutch companies already active here also in this state. As you can see, there's a huge growth of increasing of anesthesia machines in Mexico, almost 90% if you see it in 2017 until 2018. And there's also huge growth in in medical equipment, the MRI scans, the CT scanners, the X-ray machines. So also if you work in a machinery, there's also a huge opportunities here in Mexico. And I would like to talk more about this in our breakout room. Thank you very much for listening, and I will like to give the word back to Peter.
Thank you very much, René. And then we are arriving in Los Angeles. That's where I'm located right now, in downtown Los Angeles. And this office here is open this year, so which means that the less good news is that we haven't really built up on the healthcare sector, but the very good news is that we're going to do that from now onwards. There's actually a market study being done, but I want to bring you a little bit here in this area to provide you the context of the greater Los Angeles area. On this map, there's a lot of information. What you pretty much need to know is that the greater Los Angeles area is bigger than the Netherlands in terms of population, in terms of geographical size, and in terms of economy. And if you then look on the red little square, that's LA County. That's a very, very dense region. And on the next slide, you will see, I provide a little bit of health information in terms of the health providers. You see here that this little area has as much hospitals as the Netherlands does. It has not as many hospital beds, but it has many hospital beds. And there are a few really large hospitals, and on the right side you can also see some of the very famous United States hospitals are also born and based in Los Angeles. So there's a lot going on here, and it's a typical American city. So you will see that on the one hand there's a lot of rich people. Just as an indicator, the LA County has 6 times as many millionaires as the Netherlands, just as an indicator. But at the same time, they also have a lot of poor people, even a lot of homeless people that also need that access to healthcare, and which they don't always have. Plus, if you're just a middle income person, you still need to pay a lot out of pocket. So there are a lot of challenges to be overcome, and especially the pandemic really exposed how fragile the healthcare system is here in the United States and also in Los Angeles. So people are waiting for those smart solutions, digital solutions, or solutions that make the healthcare more effective, the quality increase, but also more accessible to the people. So as I said on the last slide, the good news is that right now, together with the Task Force Healthcare and the consulate in San Francisco, we are doing a market study, which will be launched next year in the first quarter. So make sure that you follow this. Actually, Leonie Schuurman is in this webinar here, so you even can contact her if you're interested to be part of this market study. And then we're actually going to start far more building up the networks here and the contacts here, and being able to even better help you in doing business. If in the meantime you feel like you need a distributor or you need help on the ground here, please contact us, because we are definitely willing and able to help you. This is about LA. We're going to move on to the next destination, not far away from Los Angeles, which is Texas, Austin, and that will be presented to you by Maria.
Thank you, Peter. Good morning and good afternoon to everybody. Thanks for joining us. Indeed, we are proud to say that Texas is a global epicenter of healthcare, not only in the US, but in the world. And actually, the Texas Medical Center is the largest medical complex in the world, with 52 medicine institutions, 21 hospitals, 8 research institutions, 4 medical schools, and even more. We have also more than 5,200 life science manufacturing related companies and research development firms. But the most important thing here is the healthcare innovation in Texas. And that is represented by TMC3, that will be an innovation ecosystem hub and will serve as a nexus between the Texas Medical Center and the research campuses. And this project will be completed in 2022. Next slide, please. Opportunities in Texas. Well, there are a lot of opportunities in this state. E-health solutions, digital health, and telemedicine appears as one of the most important opportunities, especially because of the size of this state and the long commuting times to access actually to the healthcare services, especially in remote cities and suburban areas. Medical devices is also a relevant opportunity in Texas. For example, for companies that want to deliver medication, first aid, assistive technologies, and high-tech medical equipment. Next slide, please. What is next? Well, first of all, I want to mention that we have a multiple-year strategy on this sector in Texas. We had a successful trade mission last year in life science and health, and we're supposed to have another trade mission this year with the Prime Minister that, of course, was postponed because of COVID. But in spite of that, and instead of this event, we had an interesting webinar about this sector in May. And now we are planning a multi-regional digital trade mission on Q1 for the next year, a follow-up online event on Q2. And if the situation allows, we would like to make the transition to an in-person event on Q3. For all this strategy, we are working very close with multiple organizations, as the Texas Medical Center that we mentioned before, and the largest hospitals in the state, and especially in Houston. And at the same time, we are preparing to sign an MOU in the future with the Austin Healthcare Council, that is also one of the most important medical organizations in Texas. And of course, for all these events, we would like to have you and to participate, and we can discuss more in our breakout sessions. Thank you.
Thank you very much, Maria. And from Texas, we're going to make a big jump to Belo, Horizonte. And there, Luisa will be ready for you to give the presentation.
Hello, everyone. Good afternoon. Good morning here in the Americas. My name is Luisa Hatches. I am the Deputy Representative here in NBSO Belo Horizonte. Today I'm here with my colleague Willa Moral, which is the Chief Representative in the NBSO, together with me, and we'll tell you a little bit more about the health sector in Minas Gerais. So first of all, as you can see in the picture, Minas Gerais is a large state, approximately the size of France, and we are located in the southeastern region of Brazil. So within 800 kilometers from the state capital, you'll find over 52% of Brazil's GDP. And we have 25% of the population here with health insurances. But of course, we do also have free healthcare nationwide here in Brazil. So we are also the second largest healthcare market in Brazil with over 21 million inhabitants, almost 700 hospitals, and almost 6,000 active doctors. So we have here huge companies representative like Philips Healthcare, ACG Worldwide, GE Healthcare, among some others. So in the next slide, as for the opportunities in the sector, it is important to highlight these three areas. And in the hospital design and build area, we do foresee opportunities for Dutch companies that provide, for example, innovative solutions and designs, especially in the private sector here in Brazil, which is willing to spend significant amounts to have cutting edge technologies. We also have an international medical city being planned here in our international airport complex. So this project will comprise every part of the health productive chain in the airport, so which is very handy. And secondly, for the e-health part, we can highlight the use of artificial intelligence to improve operational efficiency in hospitals and health centers, to serve as a support for clinical decisions, for example, and engage patients and doctors in the health management. And of course, the medical devices and supplies market has a great relevance here in Minas Gerais. We have a lot of room for solutions in, for example, oncology, nephrology, ophthalmic instruments, and others. And in next slide, as next steps, we have commissioned a market study in the LSH sector for Minas Gerais specifically. We already have two, one for the whole Brazil and one for Minas Gerais, a broader market study, but this one will be very much in depth. And we'll share the results with you soon in a webinar after the market study is ready. So stay tuned and hope to see you during the breakout sessions. Thank you.
Thank you, Luisa. And from Belo Horizonte, we're going to go to Porto Alegre, also in Brazil, still far away, and that will be presented to you by Lucille.
Thank you, Peter. Hello, everyone. My name is Lucila Almeida. I'm Deputy Representative together with the Chief Representative, Richard Postma. and we are based in Porto Alegre, but we are in charge of South Brazil. South Brazil is formed by 3 states, Rio Grande do Sul, Santa Catarina, and Paraná. The area has an average size of France and around 30 million inhabitants. It has a strong economic position. In 2019, had a surplus of 4 billion US dollars. The region borders with 3 countries and 2 Brazilian states, 5 big seaports with the closest ship routes to Asia, 12 airports granted by the Brazilian government. 22% of hospitals are public, while 78% private. Next slide, please. Some of the unique selling points in the region are telemedicine that is allowed by law since last March. The use in urban and rural areas is a fast growing trend, as well as in home care, allowing the population to age and heal at home. The home base of Philips Innovation, the only center of excellence in Brazil. Atrium is an ecosystem that seeks to accelerate new possibilities for health innovation based on technology, services, products, and inputs. The Brain Institute is a state-of-the-art research center. And apart from COVID vaccines, the pharma industry has facing a consistent national growth rate of 3.5%. Next slide, please. The region houses a lively innovation climate to develop medical devices, and foreign innovators are welcome. So among the opportunities, I would like to highlight the area has the highest life expectancy in the country, with continuous growing demands for innovations. For more data about this region, please access the technical report produced by Task Force Healthcare at RVO website, or request, and we'll be glad to deliver it to you. It helps to align sectors between the Netherlands and Brazil, increasing mutual understanding and inspiring collaboration. Thank you all for the opportunity to show you the region.
Thank you, Lucila. And from Brazil, we're going to go down to Argentina, last but not least, which will be presented to you by Bastian. Bastian, the floor is yours.
Thank you, Peter, and a good evening to you all. Welcome to the southern cone of the Americas. Well, Argentina has a long history of scientific research and medical innovations, such as the invention of the bypass in 1967. Also in COVID times, Argentina was one of the few countries to produce its own testing kits and ventilators. Funny fact is as well that there's an Argentinian company that has developed and installed the nuclear reactors in Borsele in the Netherlands, which is the only plant where nuclear medicine is produced in the Netherlands. Argentina is a country of 45 million inhabitants, has the 3rd GDP of Latin America, and also in the region, one of the highest expenditures in healthcare, with 9% of its GDP. Now, we look to the healthcare system. In Argentina, healthcare is public and free. However, only 37% of the people use only the public coverage. The majority have additional plans, like 30%, 37% with their employer, and 14% with private prepaid plans. Now, if we look to the industry of medical devices, implants, and inputs, Argentina has a national industry, but still the imports account for 82% and is still growing. The tariffs vary from 0 to 16%, and it's quite complicated, or at least a time investment to register. So it's important to find a good local partner, and that's where we can also help. For the opportunities also, we've just started a market study for health being executed by the Task Force Healthcare, and we expect to present as from the second quarter the results. So we will share that with you. If you are thinking of traveling to Argentina or this region, take into account Expo Medical annual fair in Buenos Aires, and the most important regional fair is Hospitalar in Sao Paulo, where also the main players of the Argentine healthcare sector will be present. So thanks, and looking forward to talk further to you in the breakout rooms. Back to you, Peter.
Yes, thank you, Bastiaan. And isn't it great that in just 20 minutes you got a glimpse of 6 different regions? And even if you have questions, particularly to your organization, this is the time you can ask, because we're going to go towards the breakouts. And to all of those of you hiding behind the screen, switch on your camera. We're going to start soon. As soon as I'm going to give the cue, also make sure you're not you're drinking enough. I'm also going to take a sip soon. And then in a few seconds, oh great, I see a lot of faces there. Everybody looks shiny, looks good. So René, this is your cue. Let's start the first round of the breakout. See you there. I had a completely 2 different breakouts, and I suppose that is also for my colleagues the case. It was really amazing. I feel with some we're definitely going to follow up. I would really recommend you to do the same. We had a lot of fun. It was very informative and very useful. It's a wrap, as it says. This is actually your part of the final edition of this year. We did 6 different dialogues on different topics. Today about healthcare, obviously. And next year, we're definitely going to do this again. And we always appreciate any feedback. If you feel this was very good, I liked it, or this wasn't that very good and you should do something different, then please let us know, because next year we're going to keep on doing this to make it easy for you, because that's what it is all about. We want to make it easy for the Dutch entrepreneur to enter new markets. So we're really at the end of the session. I don't want to keep you from going to your dinners, to your families. Thank you so much for being here. It was a great honor, and hope to see you next year. You can contact us here. You might make a print screen or write it down. We are only 1 call and 1 email away from each other. Once again, thank you very much. Thanks to my colleagues for all the efforts, and especially to René for all the technical support. And I'm really looking forward to see you next time. This was it. See you.
Thank you.
Thank you. See you all.
Thank
Thank
you.
you, everybody.
Merci, dank je.
Bye.
Bye bye.
Bye.
Au revoir, tjus.